body, and tail of the pancreas. So this is the head of the pancreas. This is the neck of the pancreas. This is the body of the pancreas, and this is the tail of the pancreas. So they all are the different parts of the pancreas. In the head, here we can see one process which is surrounding just below to the head is the oncinate process. So this is the head of the pancreas, neck in relation to the portal vein. Okay, there is formation of the portal vein just behind the neck. The body elongated and pyramidal in shape, and the tail in relation to the hilum of the spleen. So move on to the individual parts. So head of the pancreas. So here we can see the head of the pancreas, which is situated within the C-shaped curvature of the duodenum. It is enlarged, flattened right end of the pancreas. So it is in relation to the duodenum. So the duodenum is situated in the right side of our body. So it is the right end of the pancreas. So enlarged, flattened right end of the pancreas is the head, situated within the concavity of the duodenum. And the external feature of the head is it consists of three borders and the two surfaces. So the three borders are the superior border, the inferior border, and the right lateral border. So these are three borders of the head of the pancreas, and the two surfaces are anterior surface. So this is the anterior surface, and backside is the posterior surface. So the head has three borders. They are the superior border, inferior border, and the right lateral border. And two surfaces, they are the anterior surface, and behind is the posterior surface. And one process is there and the head, that is the oncinate process. So here we can see, if we follow the head, something like coma-shaped structure here, that is the oncinate process, which is in relation to the superior aspect of the third part of the duodenum. So head is this. And talking about the relation of the head, superior border is related with the first part of the duodenum. As we can see, the superior pancreatico-duodenal artery can be seen. So superior pancreatico-duodenal artery and the first part of the duodenum is related with the superior border of the head. And the inferior border is related with the third part of the duodenum, or the horizontal part of the duodenum. And the right lateral border is related with the second part of the duodenum, the bile duct, the green one, and anastomosis between the superior and the inferior pancreatico-duodenal arteries. So superior pancreatico-duodenal artery is the branches from the gastroduodenal artery. Sorry? Do you have any queries? Do you have any queries, someone? Anybody asking something? Okay. So right lateral border, here we can see the second part of the duodenum, the bile duct, and the anastomosis between the superior and the inferior pancreatico-duodenal arteries. So superior pancreatico-duodenal artery is the branches from the gastroduodenal artery, whereas the inferior pancreatico-duodenal artery is the branches from the superior mesenteric artery. So the anastomosis around the C-shaped curvature of the duodenum, and it is in the relation to the right lateral border of the head of the pancreas. Do you have any queries? Dhirendra, are you there?
Yes, ma'am.
Do you have any queries?
No, ma'am.
Okay. Karisma, are you there?
Yes,
Karisma,
ma'am.
do you have any queries?
No, ma'am.
Okay, if you have any queries, you can ask, okay?
Okay, ma'am.
Okay, move on to the anterior surface of the head. So this is the anterior surface of the head, which is in relation to the gastroduodenal artery and the transverse colon and jejunum. As we know, the transverse colon, which goes upward from the ascending colon, and it goes like this. So it is in relation to the transverse colon, gastroduodenal artery, and some coils of the jejunum. So the anterior relation of the anterior surface of the head in relation to the gastroduodenal artery, transverse colon, and the jejunum. So here we can see the transverse major colon. The posterior surface of the head is related with the inferior vena cava. So this is the inferior vena cava, the renal veins, and right cross of the diaphragm and the bile duct. So they are the posterior relation of the head of the pancreas. So inferior vena cava, renal veins, right cross of the diaphragm and bile duct, they are in posterior aspect of the head of the pancreas. Process which is in relation to the third part of the duodenum, and very important relation of the uncinate process is the superior mesenteric vessels on the anterior aspect, superior mesenteric artery and the vein, and on posterior aspect the aorta. Okay, so they are very important relation of the uncinate process. So the next part of the pancreas is the neck of the pancreas. The constriction between the head and the body is the neck of the pancreas. It is slightly constricted part between the head and the body, and in relation to the very important structure in the posterior aspect, that is the portal vein, and on the anterior surface it is related with the lesser sac. So this is the peritoneum or the fold of the peritoneum, lesser sac, in the anterior aspect of the neck, the pylorus of the stomach, gastroduodenal and superior pancreaticoduodenal artery are also in the anterior surface. So this is the neck of the pancreas, and these structures are in the anterior relation, anterior surface of the neck. So peritoneum of the lesser sac, which is present in the lesser curvature of the stomach, the pylorus of the stomach, gastroduodenal and the pancreaticoduodenal arteries. So they are in the anterior surface of the neck. So this is the neck of the pancreas. The posterior surface of the neck is in relation to the portal vein. So the formation of the portal vein by the union of the superior mesenteric vein and the splenic vein just behind the neck of the pancreas. Here we can see the faded line. Okay, so this is the formation of the portal vein, which is in relation to the posterior aspect of the neck of the pancreas. So this is the portal vein. So superior mesenteric vein just behind and splenic vein, they united together to form the portal vein. So this is very important relation in the posterior aspect of the neck of the pancreas. So next part is the body of the pancreas. So do you have any queries till now? Jenisha, are you there?
Yes, ma'am.
Do you have any queries?
No, ma'am.
Okay, Sanish, are you there? Sanish,
Yes, ma'am.
do you have any query?
No, ma'am.
Are you getting?
Yes, ma'am.
Okay. So let's discuss about the body of the pancreas. So this is the body of the pancreas. Okay, from the neck to the tail part is the body of the pancreas. It is something like pyramidal shape, elongated structure, passes upward towards the left. Okay, so something like obliquely placed. So the body is passing just upward towards the left side, and it is triangular or the pyramidal shape in cross section. If we cut it here, it will be the pyramidal shape or the triangular shape. External features, there are three borders on the body. So it is very important because they are the anterior border where there is attachment of the transverse major colon. Okay, so this is the anterior border. This is the superior border above, and behind and below is the inferior border. So three borders of the body are the anterior border, superior border, and the inferior border. And three surfaces are the anterior surface or the anterior superior surface, inferior surface or the anterior inferior surface, and behind will be the posterior surface. So these are the borders: superior, anterior, and the inferior border. Surfaces are anterior surface, inferior surface, and behind is the posterior surface. So the anterior border, it separates the anterior from the inferior surface, and there is attachment of the root of the transverse major colon. It is very important for MCQ. Okay, So transverse mesocolon is attached towards the anterior border of the body of the pancreas. So it separates the anterior surface from the inferior surface. So here we can see the anterior surface, and this one is the inferior. So in some book they also written the anterior superior surface and the anterior inferior surface. And the superior border presents a conical projection known as tuber omental. The elevation can be seen here. That is the tuber omental. It is in relation to the celiac trunk. Omental means the fold of the peritoneum, the lesser omentum. Okay, so this is the tuber omental. The elevation and the celiac trunk is in relation to this. So superior border is this, and the inferior border related with the superior mesenteric vessels, so behind and below. Just this is the inferior border in relation to the superior mesenteric vessels. So once again, three borders are anterior border, superior border, and the inferior border, and the surfaces are anterior surface, inferior surface, and behind will be the posterior surface. So this is the body of the pancreas. So anterior surface is related with the lesser sac of the stomach. As we discussed before, the lesser sac is the fold of the peritoneum in relation to the lesser curvature of the stomach. And the posterior surface is related with the different structures. They are the aorta, okay, aorta, superior mesenteric artery, the left suprarenal gland. So this is the left suprarenal gland, left kidney, left renal vessels, and suprarenal and the left gonadal veins. They are the branches from the abdominal aorta and the splenic vein. So they are the posterior surface in relation to different structure. So very important: aorta, superior mesenteric artery, left suprarenal gland, left kidney, left renal vessels, left suprarenal and the left gonadal veins, and the splenic vein. They are in the posterior surface. And the inferior surface, they are related with the duodenojejunal flexure, the folding here, the coils of the jejunum, and the left colic flexure in relation to the spleen. So they are the structures in relation to the inferior surface. Okay, so jejunum will be here, and the duodenojejunal flexure is here. So they are the very important structure in the anterior aspect, posterior aspect, and the inferior aspect of the body of the pancreas. So for exam purpose, the relation are important for gross. Okay. So talking about the body of the stomach. So body of the stomach is in the anterior relation of the body of the pancreas. So this is the stomach. Okay. So this is the body of the pancreas. So it is posteriorly situated and stomach is anteriorly situated. So anterior relation, the body of the stomach. So move on to the pancreas, the tail of the pancreas. So conical part, which is in relation to the spleen, hilum of this tail of the pancreas. It is narrow and left end of the pancreas. It lies within the leno-renal ligament. Leno-renal means the folding between the folding of the peritoneum between the spleen and the kidney, and which is the hilum of spleen, and higher level opposite the T12. Sometimes it may be of the T12. So this is the tail of the pancreas. So that is all about the different part of the pancreas. So first of all, head with the uncinate process, the neck, the body, and the tail. They are the different parts of the pancreas. So move on to the duct system. The pancreatic ducts, there are two types of the duct. They are the main pancreatic duct and the accessory pancreatic duct. So here we can see the main pancreatic duct, which extending from the tail to the head, and it opens into the major duodenal papilla in the posterior aspect of the second part of the duodenum, posterior medial aspect of the second part of the duodenum, and the accessory pancreatic duct, which opens just 2 centimeters above the major duodenal papilla in the minor duodenal papilla. So the main pancreatic duct, also known as duct of Wirsung, formed by the union of number of smaller ducts. So here we can see the union of the smaller duct in the different parts of the pancreas. It looks like herringbone pattern, okay, also termed as herringbone pattern of the union of the different duct system of the pancreas, and reaches the posterior medial wall of the second part of the duodenum. So this is the posterior medial wall of the second part of the duodenum, where it meets with the bile duct. Okay, so the secretion of the gallbladder carried by the bile duct and secretion of the pancreas carried by the main pancreatic duct, they united together to form the hepatopancreatic ampulla, and the secretion they pour into the second part of the duodenum. So both the duct, they pierce the duodenal wall separately and later unite to form the ampulla, which opens on the summit of the major duodenal papilla. So this is the major duodenal papilla. It is situated 8 to 10 centimeter from the pyloric end of the stomach. Okay, like this. So this is the major duodenal papilla, which is the opening of the main pancreatic duct, and it pours the exocrine part, the secretion of the pancreatic enzyme, all the secretion, they pour into the second part of the duodenum and responsible for the digestion of the food. So it is situated 8 to 10 centimeter from the pyloric end of the stomach. Okay, so this is the main pancreatic duct, and this pattern is known as herringbone pattern. Accessory pancreatic duct, also known as duct of Santorini, it begins from the lower part of the head. So this is the lower part of the head. This is the onset process, passes upward and to the right in front of the main pancreatic duct, and finally opens into the duodenum on the summit of the minor duodenal papilla. So this is the minor duodenal papilla, which is situated 2 centimeter above the major duodenal papilla. So majority of the secretion of the pancreas, the pancreatic enzymes, they pour via the major pancreatic duct into the major duodenal papilla, and the minority from the head side, it drains into the minor duodenal papilla. So this is the very important features in the second part of the duodenum we discussed before. So that is all about the exocrine part of the pancreas. The exocrine part is similar to the parotid gland, similar to having the acinus. So we discussed in the histology class also. And the endocrine part of the pancreas is the islets of Langerhans. It comprises the endocrine part of the pancreas, that is the islets of Langerhans, dispersed throughout the pancreas as isolated colonies of ovoid cellular masses. So here we can see the one focused mass, that is the islets of Langerhans, the different color, and the number of the islets of Langerhans, 1 million or more, especially towards the tail of the pancreas. So this is the Langerhans we can see in histology practical. If we focus on the islets of Langerhans, it consists of collection of polyhedral cells and fenestrated capillaries. And the cytoplasm has the secretory granules, and it consists of different cells. They are the alpha cells, beta cells, okay, and delta cells and PP cells. So alpha cells are responsible to secrete the glucagon hormone, and that is around 20%. And beta cells are more, that is 60 to 80%, and responsible for secretion of the insulin. Delta cells, they secrete the somatostatin, and the PP cells, they secrete the pancreatic polypeptide hormone. As we know, that there are more number of cells are the beta cells, okay, 60 to 80%, and they are responsible for the secretion of the insulins. As we know, the insulin are anti-diabetic hormone in our body, so they protect our body to become the diabetic. And glucagon is responsible for, it is the diabetogenic hormone, so they counteract to each other. And the delta cells, which secretes the somatostatin, and they counteract, they helps to suppress these two hormones, okay. And pancreatic polypeptides, they are responsible, they are secreted by the PP hormones, PP cells, pancreatic polypeptide cells. And talking about the arterial supply of the pancreas. So here we can see the branches from the celiac trunk, gastroduodenal artery, superior pancreaticoduodenal artery, and this one is the inferior pancreaticoduodenal artery branches from the superior mesenteric artery. So the head and the neck region is supplied by the superior pancreaticoduodenal artery and the inferior pancreaticoduodenal artery. They are the branches from the celiac trunk and superior mesenteric artery. And the body and tail, they are supplied by the pancreatic branches of the splenic artery. So here we can see this is the splenic artery. It also gives small branches, pancreatic branch, so which is responsible to supply the body and the tail of the pancreas. Among them, one artery is the longest one and the largest one, that is known as arteria pancreatica magna. Okay, so it is also responsible to supply the body and the tail of the pancreas. Ultimately, the splenic artery, as we know, it is also the branches from the celiac trunk. And talking about the venous and the lymphatic drainage. So here we can see the venous drainage and the lymphatic drainage. So the veins drain into the splenic and superior mesenteric vein, and ultimately it drains into the portal vein. As we discussed before, the superior mesenteric vein and the splenic vein, they united together just behind the neck of the pancreas to form the portal vein. So ultimately the venous drainage towards the portal vein, and the lymphatic drainage into the pancreatico-splenic and celiac and superior mesenteric group of the lymph nodes. Yeah. So do you have any queries till now? Anybody? Sudeep, are you there? Sudeep? Nisha, are you there?
Yes, ma'am.
Do you have any queries?
No, ma'am.
Are you there? Megha, are you there? Dilasa, are you there?
Yes, ma'am. Yes, ma'am.
No, ma'am. Okay. If you don't understand, you can ask, okay? So move on to the nerve supply. The parasympathetic nerve supply to the pancreas is by the vagus nerve, and it controls the pancreatic secretion, and sympathetic by the splanchnic nerves, and they are vasomotor. And secretion is also influenced by the hormone, that is cholecystokinin, produced by the cells of the duodenal epithelium. If the food content which reaches to the duodenum, they stimulate the duodenal cells, duodenal epithelium, to produce the hormones. They are the cholecystokinin, pancreogenin, and they are responsible to increase the secretion of the pancreas and responsible for the digestion of the food. So it is influenced by the sympathetic, parasympathetic, as well as the hormones within the secreted by the duodenal epithelium. So this is the nerve supply. And very important aspect of the pancreas is the clinical aspect. So diabetes mellitus is the deficiency of insulin. If the beta cells which are present in the endocrine part of the pancreas cannot secrete sufficient amount of the insulin, it can cause the diabetes mellitus, and digestive disturbances can be caused, that is because of the deficiency of the pancreatic enzyme. So the pancreatic enzyme, they are responsible for the digestion of the food. If there is lack of enzymes, there may be the indigestion problem. And pancreatic cancer, the carcinoma of the head of the pancreas, is common. It is common and complicated also. And pressure over the bile duct, persistent obstructive jaundice can be seen. So the cancer of the neck and the body cause the hepatic portal or the inferior vena cava obstruction, and severe pain towards the backside of the body will occur. Because of the cancerous lesion, it can compress the inferior vena cava and the portal vein, leading to the severe pain on the back. Okay, so this is the head of the pancreas or the pancreatic cancer. And acute pancreatitis is there. So endoscopic retrograde cholangiopancreatography is the investigative procedure, ECPR, which is done by the contrast radiograph by the endoscopic guidance. So then we can see the duct system of the pancreas. If there is any blockage, if there is any tumorous lesion compressing the duct system of the pancreas, can be easily visualized. And many times it may be obstructed because of the gallstone. Okay, gallstone, they come via the bile duct and it can obstruct in the opening of the ampulla of the bladder. So that it may cause the different clinical conditions. So one of these is the acute pancreatitis, inflammation of the pancreas. So this is the endoscopic retrograde cholangiopancreatogram. So this is the contrast X-ray visualized in the duct system of the pancreas. So this is the bile duct, and this one is the main pancreatic duct, and this one is the ampulla of bladder. So all the important aspect of the pancreas is the development. It is important for example point of view. Okay, it may ask in MCQ and SCQ also. So for the development of the pancreas, the larger dorsal and the smaller ventral pancreatic buds, they arises from the terminal part of the distal part of the foregut. They fuses later on. Okay, so here we can see the stomach. This is the terminal part of the foregut, or the second part towards the second part of the duodenum, and liver bud can be seen, gallbladder, and here we can see the ventral pancreatic bud, and this one is the dorsal pancreatic bud. Later on, because of the folding of the gastrointestinal tract or the tubular system, the ventral pancreatic bud, it goes and it sits just below the dorsal pancreatic bud to give rise to the total pancreas. Okay, so ventral bud, and it gives rise to the uncinate process and the inferior part of the head. So this ventral bud is responsible to develop the uncinate process and the inferior part of the head, and the dorsal bud, it gives rise to the major part of the head, whole of the neck, body, and the tail. So the dorsal pancreas, it gives rise to the majority of the structure of the pancreas, except the uncinate process and the inferior part of the head, which is developed from the ventral pancreatic bud. So this is the ventral pancreatic bud, and this one is the dorsal pancreatic bud. During the rotation of the gastrointestinal tube, the ventral pancreatic bud, it moves, it sits just below the dorsal pancreatic bud like this. Okay, and the main pancreatic duct and the accessory pancreatic duct also developed within it. And other clinical aspect is the annular pancreas. This term is during the rotation of the ventral pancreatic bud towards the dorsal side, it can constrict the second part of the duodenum. Okay, so that condition is known as annular pancreas. So the developmental anomaly where it encircles the second part of the duodenum, and the duodenal obstruction can occur because of the constriction in this area, that is known as annular pancreas. It is because of the defect in the rotation. That is all about the pancreas. So do you have any queries?